Hello, I'm Dr. Lipi Roy, and welcome to my show, Health, Humor, and Harmony. Today's show is about a medical condition that complicates up to 8% of all pregnancies worldwide and causes 15% of premature deliveries. May is Preeclampsia Awareness Month. I will also connect this to another important health topic that has social and economic consequences. May is also National Teen Pregnancy Prevention Month. Let's get started. First off, what is preeclampsia? It's considered a hypertensive disorder of pregnancy, or HDP, and is a serious complication of pregnancy that can be dangerous for both mother and baby. Preeclampsia is most often characterized by a rapid rise in blood pressure, or hypertension, and protein in the urine, or proteinuria, typically after the 20th week of pregnancy, and it can lead to seizures, strokes, multi-organ failure, and death of the mother and or the unborn baby. When the blood pressure exceeds 140/90, the mother's heart and other organs become stressed. Preeclampsia also impairs blood supply to the placenta and impairs liver and kidney function. In fact, proteinuria is a sign of kidney dysfunction. Who gets preeclampsia? While it's more common in first-time mothers, experts aren't really certain why some people develop preeclampsia and others don't. Some known risk factors include a history of high blood pressure, kidney disease, or diabetes, expecting multiples, like twins, triplets, family history of preeclampsia, obesity, and autoimmune conditions like lupus. So what are the signs and symptoms of preeclampsia? Many women experience no symptoms. For others, early signs include hypertension, proteinuria, and water retention, as evidenced by weight gain and swelling. Other symptoms include headaches, blurry vision, right-sided abdominal pain, shortness of breath, and swelling of the face and hands. Severe preeclampsia can include a hypertensive emergency, over 160/110, fluid in the lungs, low platelets or thrombocytopenia, and low urine output or oliguria. The doctor will check the patient's blood pressure, weight, and urine. Additional testing can include blood tests for kidney and liver function, as well as a fetal ultrasound. So what's the treatment for preeclampsia? It depends on the severity of the condition and gestation. For instance, if the patient is close to full term, i.e. 37 weeks pregnant or more, then the doctor will likely recommend delivery. Medications may also be prescribed to lower the mother's blood pressure and improve the baby's lung development. The only cure for preeclampsia is delivery. During labor and delivery, intravenous magnesium is often administered in patients with preeclampsia to prevent the development of eclampsia, which is a severe complication of preeclampsia involving seizures. Are there ways to prevent preeclampsia? Yes. Patients can reduce risk factors by losing weight if overweight or obese, controlling blood pressure and blood glucose, exercising regularly, and avoiding salty food and caffeine. Now, let's shift gears to a related pregnancy topic. As I mentioned earlier, May is National Teen Pregnancy Prevention Month. According to the CDC's National Prevention Information Network, great strides have been made over the last 2 decades at achieving the lowest teen birth rates in history. However, progress still needs to be made in reducing racial, ethnic, and geographic disparities in teen pregnancy rates across the United States. While rates are at a historic low, the U.S. has one of the highest teen birth rates in the industrialized world, mostly among Black and Native American teenagers. So why is prevention so important? Studies show that teenage pregnancy and childbearing are associated with significant social and economic costs. In the US, for example, teenage childbearing cost taxpayers nearly $10 billion in 2010 due to increased health care and foster care, as well as lost tax revenue because teenage mothers typically attain less education and learn less income compared to their non-pregnant counterparts. In addition, only 50% of teenage mothers earn a high school diploma by age 22, compared to 90% of girls who do not give birth during their teens who go on to graduate from high school. Equally concerning is that children born to teen parents tend to attain less education, are more likely to drop out of high school, enter child welfare and correctional systems, and become teen parents themselves. And so the cycle continues. We also need to empower adolescents with accurate, evidence-based sexual and reproductive health information. Research shows that adolescents aged 15 to 24 account for nearly half of the 20 million new cases of sexually transmitted infections, or STIs, each year. Teen birth rates are particularly high among specific populations, namely youth in foster care, youth who are homeless, and LGBTQ+ youth. So, how can you get involved? You can donate to, volunteer with, and learn more from the National Institute of Child Health and Human Development, the American College of Obstetrics and Gynecology, the European Foundation for the Care of Newborn Infants, the Preeclampsia Foundation, the CDC's National Prevention Information Network, and the Department of Health and Human Services Adolescent In fact, you can download their digital toolkit. This year's theme is Elevating Voices, Effectively Engaging Adolescent Males. You can also wear yellow in support of teen pregnancy prevention and post hashtag NTPPM and hashtag teen pregnancy prevention on social media. Well, that's all for today. Here's your doctor joke of the day. What did the patient ask the radiologist after he swallowed nickels and dimes? Did you see any change in me? Join me Friday, 3 p.m. Eastern, when I'll be talking about Huntington's awareness. And be sure to subscribe to my YouTube channel, make comments below, and follow me on Instagram at Health Humor Harmony, Dr. Roy. Be well. I'll see you soon.